also wanting to continue the work that we started in our first budget of trying to get the budget back into surplus. The previous Liberal government, largely out of necessity, had to incur very significant budget deficits, as not only did their revenues constrict in the early parts of the COVID pandemic, but also they had to spend a lot more money on either providing increased community services or trying to support people in the community and economic activity. Those deficits were very, very significant, and we know that we need to transition the budget back into surplus, not just because we know that we're managing the state's finances more prudently, but we should also be aware that while the economy's been performing very strongly over the last 18 months, the headwinds are already blowing for the national economy, including here in South Australia. And we are going to transition to a period over the next 12 to 18 months of significantly lower economic growth and economic output. And it's important to have a budget surplus in those conditions so that if we need to deploy additional support to the community, whether it's through government services or whether it's through direct support to households or businesses, then we've got a bit of additional capacity to do that. And of course, it's now July, and Christmas seems ages ago, but of course we've still got those communities along the length of the Murray dealing with the most significant flood event down the river in South Australia that we've experienced for more than 50 years. And so we've had to significantly step up our flood response and recovery efforts and resourcing behind those efforts in order to help those communities recover from the floods. So we had all of those issues front of mind as we were putting the budget together. And so I'll speak very, very briefly and more succinctly than that introduction about some of the key areas that received funding in the budget. But first amongst them was, of course, health. Last year, I was proud to report that we deployed the biggest additional step up in health spending of any budget of any government in the past. Well, this budget's had to exceed that again in providing not only a step up to meet that additional activity coming in through the front doors of our hospital, but also to extend for a much longer period of time the additional capacity we had been funding in our hospitals to deal with COVID and to deal with the persistently high number of patients who are suffering from COVID in our hospitals. And previously, both we and the previous government had been extending that funding for maybe 6 months or at most 12 months at a time. We've had to drag that out for more than 3 years in this budget. I've just noticed that my voice is coming in and out. Can you all hear me? Okay, oh good. Sorry. Last thing you wanted to hear was me starting all of that again. So health, we've had to step up resourcing. But I'm really pleased to say that what this budget also funds in health is some of the hard work of trying to come up with initiatives and programs of making it easier for South Australians to get access to healthcare without necessarily having to turn up at an emergency department. And also for people who are in hospital and for people who are stuck in hospital, who shouldn't really be in hospital, providing some capacity and resources to get those people out of hospital as well. So trying to divert people from coming into hospital in the first place, but also getting people out of hospital much quicker. And so while I gave you that figure before, 129 people occupying hospital beds in the week that we released the budget, pretty much every week we will have a further 100 people occupying metropolitan hospital beds who probably should be home recuperating but can't because they haven't got the in-home support, or who should be in an aged care place but they can't get access to an aged care place, or who are just waiting for assessment under the NDIS to get their package approved for funding there. We are having to pick up that additional cost of having those people in hospital. And having those people in hospital, of course, is the most expensive place that our community can possibly accommodate them. We can get people into their homes, they'll recuperate a lot more quickly, of course, but it's also far more cost effective than having them in hospital and so on.